Hello, thank you so much for tuning in. I am Rayaan Muhammad, and I'd like to take some time and discuss with you what I've been doing this semester in research. So, as we all know, medicine it's come a very far way in treating a lot of diseases and conditions. But one challenge that we still face is really finding effective ways to deliver drugs to patients to treat them. And this is where hydrogels can come into play. Hydrogels, they are essentially water-swollen materials with a unique ability to hold and encapsulate drugs that are loaded into them and then release those drugs in a controlled period of time. And this technology for precise delivery of drugs, we can use that to deliver drugs to specific parts of the body to improve the efficiency of treatment and reduce side effects. So, for example, let's say that a person, a cancer patient, he needs a specific amount of any drug 3 times a day. Well, rather than injecting that patient 3 times a day with that drug, what we could do is we could first load that drug into the hydrogel and then load that gel into the human body. And by itself, what will happen is that gel, it will, over a controlled period of time, it will release a controlled amount of drug 3 times a day into the body of that patient. So what will happen is that we just reduced the dosing, the injection times by from 3 to 1. And that's why we really believe in this technology. We really believe that hydrogels, they have the potential to revolutionize how we do medicine and really improve how we deliver drugs to our patients and really just change and make things a lot better. So that's why we believe in it. And as we just discussed, these hydrogels, they have a lot of application in medicine. They also in medical surgeries, to load drugs into them for any use, and also whenever we want to do research for other fields and culture cells, load those cells into the gels, they can do it just fine. And furthermore, even if you want to engineer tissues, they can be completely compatible with other tissues, foreign tissues. So those are things that hydrogels can do just in general. But to be more specific and to hone in on what we've been doing, we've been wanting to make a hydrogel that has two things, that's two properties. Number one, it's biocompatible with the human body. And what that means is that that drug that we load into the gel, that gel will not interfere with any activity in the body. It'll be completely safe for the body. So we want the gel that's really compatible with the human body. It will not cause any issues. And number two, we wanted a gel that whenever we load and encapsulate a drug into the gel will be able to hold that drug, and then whenever that gel is injected and introduced into the human body, it will not just break apart right away. It will stay there in its shape, gel shape, and then over time slowly liquefy and release what is inside. So to do this, based on previous studies and literature and findings that we've seen, we found two things that would be really good for this, two materials. So we have NADC, sodium deoxycholate, and also trees, so trees hydroxymethyl amino methane. And these were our two materials. So what we end up doing, so we just varied. We wanted to see what concentrations of NADC and what concentration of trees would give us. And of course, we had already verified that these are both, a gel made by both of these is biocompatible, so that was not an issue. No need to test that. But what we wanted to test is at what concentration of trees and at what concentration of NADC would the hydrogels liquefy, and what concentration of those would give us the result of a gel that can hold the most amount of material, the most amount of a drug. And basically, here's what we did. So, of course, we first synthesized, we made the drug, we synthesized the hydrogel. We used trees first, and that's our base material. These gels are, I would say, 95% water, a lot of water, and we did some calibrating. We then added NADC as a gelator to just gel everything up, and then we did a lot of mixing, sonication, and vortexing to really get those things to come together. And if we look, the structure over here on your right, this is what a gel is supposed to look like, and next to it, the little crystallized material you see, that is what happens whenever we get a structure we really don't like, not really a gel-like structure. And even when you get we found that even when you get a physical appearance that looks right, you have to also do something called inversion test. So just simply flip that gel the vial on its head, and if the gel, as you see over here, if the gel can stay as a gel, then that really is what we want. Whereas if it is more liquidy over here, that's not really, the characteristic we want. It's not going to be really good at holding the drug. So that's really a little bit about the structure of the gel. And now, so the first test we can discuss is the swelling ratio, and this test would tell us how much, what amount of drug a particular hydrogel can hold at that concentration. So what we found is that really the amount of so we looked at also we looked at pH as well. We wanted to see would pH even though the pH of 7.4 is the physiological pH of the human body, we were also curious to see if perhaps results could be improved if we used perhaps even a lower pH. So we did that, all those things. And first, when we varied the amount of tris, when we increased the tris, we found that the gel, it decreased in its ability to hold the drug. And what this test is, the swelling ratio test, it's we take the weight, so we load one hydrogel, we give it PBS, we give it PBS, and we gave it about 10 milliliters. And of course, it is not going to absorb all of that. We just wanted to make sure that we could do as much as possible. So we gave a lot of PBS, and whatever amount did not absorb, we just pipetted that out. So we wanted a swollen gel, basically. That is our swollen gel. And then we took another gel, and by the way, these two gels are going to be identical in everything. They're going to be identical in their weight. They're going to be identical in their concentration. Everything. It'll be identical in everything. So we take the weight of the gel that had PBS, the swollen gel, and we also subtract from that the weight of the gel that was in a desiccator, the dry gel, and we express the difference between the weights of those as a percentage. And that difference in weight, it's going to be due to how much drug we have loaded into the gel, how much PBS, right? That will be our example, or representation of the drug in real world scenarios. So we express that difference as a percent, and that is our swelling ratio. And we found that as we increase the concentration of trace, we decrease the swelling ratio, which means that we decrease the ability of a gel to retain and hold the amount of drug that we want. So if we want to make a drug that can hold if we want to maximize the amount of drug a gel can hold, we gotta decrease the trace concentration. And also, we were curious, we wanted to see what effect pH could have, so we looked at pH, and we saw that as we decrease the pH, we improve the swelling ratio. So that means that a lower pH is better for wanting to maximize the ability of a gel to store a drug, as we see right over here. And that is just all of this expressed in graphs, that was in the tables. And then the next experiment, solubility to gel temperature, where we wanted to find out how much heat we would need to turn those gels to liquefy those gels, right? So we wanted to see if, what range will that occur, because we want these gels to be gels and not just become liquid immediately in the human body. So how we do this, we take we have a water bath, and we put that bath on a hot plate. We heat it up slowly, and as the gels are heating up, and when we have a temperature probe recording the temperature, and we observe when is that becoming a liquid, and when it's becoming a liquid, we note it down, record that, and that's how we have these values here. So we found that as we increase the amount of trace, actually the trace was bad for what we wanted before in swelling ratio, but it's actually better for keeping the structural integrity of the hydrogel. So it improved by almost 1 full degrees, about 0.7 degrees Celsius on average. And then we also looked at to see what would happen if we varied NADC, and it was an increase, yes, but not nearly as noticeable, so almost negligible. So that leads us to believe that the NADC concentration does not really matter. What matters most is trace concentration, and this is all of that just expressed in graphs. So that's what we did, and the biggest challenge with this project was synthesizing those gels, because they are very, very sensitive. Even the smallest amount of impurities will cause them to crystallize, as we see over here. Let's look back at the structure, cause something to come like this, and that we can't do anything with that. And this could be cause impurities whenever you're adding trace, or the water that you're using is contaminated, or anything, or even anything. It's very difficult to make them, but we successfully did synthesize them, and we found that trace, it's good for maintaining the structure of the gel, but it's not good for maximizing the drug's ability to hold or the gel's ability to hold a drug. So that's what we did there. And in the future, We would like to explore more NADC's ability or not ability, what its impact on affecting how a hydrogel could store a drug. Perhaps a hypothesis is maybe it will do the same thing as Treese, decrease swelling ratio, but we have to, do the experiment to prove that, and we have to also, we would like to see, we only looked at pH of 7.4 in solubility gel, maybe we can vary the temperature and see how, or vary the pH to see how that will impact the temperature. So that's what we did, and a special thank you to the Signature Award for sponsoring us and helping us out. And of course, this was all conducted in the chemistry department of UA Little Rock, so thank you to them. And also the Surf Award. We are grateful for their support and their aid. And yes, thank you for listening, and that is what we did.